my name is Mackenzie, and today I'm going to be going over chest tube and chest tube drainage system education with my patient. It is January 16th and it's approximately 1 o'clock. Okay, so my patient today is a 22-year-old female. She came into the ER with difficulty breathing, and so we did a chest x-ray and we found that she has an empyema. And so basically that is just an infection in the pleural cavity, and so we're going to do a chest tube and a drainage system for her to help drain that pus out and help get rid of the infection. So now I'm just going to explain all this to my patient and what's going to be going on. Knock, knock, knock. Hi, my name is Mackenzie. I'm going to be your nurse today.
Hi.
So we did a chest x-ray and we found out that you have an empyema, which is basically an infection in your pleural cavity. So it's an infection in your lung and surrounding it. So we're going to insert a chest tube. Have you ever heard of one of those before?
No.
Okay, so basically what it is, it's a clear plastic tube. It's about this long. And we're going to insert that into like right in between your ribs, like right on the side of your chest. And you're going to be awake, but we're going to give you some pain medication. We're going to numb the area to help ease the pain and help keep you comfortable. While we're doing all that, we're going to make sure that we're viewing your vital signs and your respiratory status and make sure everything's stable. And like I said, we're going to keep you as comfortable as we can, but I'm not going to sugarcoat it. It's not going to be the most fun thing you've ever done. But now I'm just going to kind of go over some basics. So after we have inserted the chest tube, you're going to have this drainage system, and it's going to sit in your hospital room. And so after the tube is inserted, we're going to hook it up to this right here, and this is just going to drain into this system. And so this has got 3 kind of chambers on it. So this is the suction part of it. If we have to hook it up to suction, this is where we will mess with that at. This right here, we're going to put some water in it, and that's just going to help equalize the pressure between the incision that we have in your side in the chest tube and the apparatus itself. And then this part right here, this bigger portion, is going to collect the fluid or pus that we get out of your pleural cavity. Every day, or at the end of every shift, the nurse is going to mark where it is drained. So say you drained 60 mL that day, the nurse is going to put her initials and a line and the date and time just to show that that is how much collected during the shift, because these are never drained or dumped. So if for any reason it fills up, we will either get a new drainage system and we will discard of this one. If you see us come in with a big red bag and tie this up, that's what we're doing. We're either changing it out or it's time for your chest tube to come out, which is a good thing. So that's what this is. Like I said, this will sit in your hospital room. It's taped to the floor because we never want to knock these over, because that can mess up the pressure in the system, and it could also pull out the chest tube itself, which is bad. We don't want to have to go through that multiple times and putting it in.
Okay.
So after we get the chest tube in, and when we hook it up to the drainage system, we're going to have a dressing around it. So one of the main things we're going to have is this zero-form dressing, which I have this, I'll open it up for you. It's kind of this yellowy Vaseline medicated gauze, basically. But that's just going to go around your chest tube site, and that's going to help seal off anything, like prevent any air leaks or anything like that. And then next we're going to have these drainage sponges. So say this is our tube, we're going to put one below it and one above it. And then after all that stuff, we're going to put a foam tape over the top of it to kind of just hold it all together. And that way you can get out of bed and move around and not have to worry about your chest tube coming out. Another thing that will be in place is 2 stitches. So they'll be on either side, and that's just another precautionary thing to help keep it in place.
Okay. So do you put the chest tube in?
No, a physician will put it in, and a physician will also take it out.
Okay.
So they say roughly 2 to 3 days is how long a chest tube will stay in. It could be shorter, it could be longer.
Okay.
It just depends how you're doing, how much is strained out, that sort of thing. But we will be monitoring that the whole time.
Okay.
When it comes time to remove your chest tube, we will monitor your vital signs, like I said, your respiratory status, all of the good stuff that we're going to be doing the whole time.
Okay.
But then right as soon as we remove it, we'll do a chest x-ray to make sure your lung is reinflated. And we just want to make sure that everything looks good. Because like I said, we don't want to have to go through this multiple times.
Right.
Do you have any questions for me?
No, I think you covered it.
Okay,
Yeah.
perfect. All right. Well, I'm going to go talk to the doctor and we'll come in and get this started.
Okay, thanks.
Thank you.